Hey, OncoPT, and welcome back to this episode of the OncoPT podcast. Now, continuing with our CSM preview sessions, we have another dynamic panel of speakers who are going to be talking to you all about a very, very special subpopulation of our oncology patient population. And that session, if you're looking for it on the CSM website, is called I'm Too Young for Cancer, Addressing the Needs of Adolescents and Young Adults with Cancer. And so if you already know about the session, you know I'm super excited about it. If you don't, friend, buckle up because we're in for a real treat this evening. All right, so first speaker of our panel tonight is our beloved Scott Capozza. Welcome back to the OncoPT podcast.
Thanks, Elise. It's always great to be here, and really thank you for taking the time and using your platform to be able to elevate all these different amazing speakers that we're going to have coming from around the country to present in the great city of Boston.
So next up, we have another return guest from the OncoPT podcast, Eric Galvez. Welcome back to the OncoPT podcast.
It's great to be here. Looking forward to it. I'm looking forward to the session. So, yeah, Scott, thanks for inviting me.
And then we have a new guest on the OncoPT podcast. We have Leanna Blanchard. Welcome. We're so excited you're here.
Thanks. I'm really excited to be here. And again, kudos to Scott for putting us all together and connecting so many awesome people.
All right, I'm going to go off script already, but I think it's a good question to start with. How did this panel of speakers, we've got one more who couldn't make it this evening, but how did this particular panel of speakers come together on this very wonderful and important topic?
I started to try to plant these seeds when we were in San Diego earlier this year. It was my first in-person combined section since we had all been in Denver. So it was nice to see so many familiar faces, but to also see so many people who I had only really connected with online. I had never met Leanna before in person. I had never met Eric before in person, and Brianna DeWitt, who is our other co-presenter who couldn't be here with us for this recording. I have been following her on Instagram for a while. Learned her story, and so I kind of went to each of you kind of individually, and I said, I feel that the adolescent and young adult population, which abbreviated as the AYA population, kind of gets lost in transition because they're not pediatric and they're not the older adult population. And so there's so many transitions that go on. And especially for any of the students that are listening right now, or the new professionals, anybody who's in their 20s and their early 30s, they can appreciate all these different transitions that are going on. And then if you throw a cancer diagnosis into that, then it just throws a monkey wrench into everything, and it just delays all of those things from happening. So I kind of went to each, to Leanna and to Bree and to Eric individually, and I said, "What do you think about this?" And they all said, "Wow, this sounds like it'd be a fun idea." So that's how it all kind of started. It was just making those personal connections, which I really, I think is one of the strengths of what we do in OncoPT is these personal connections.
Mm-hmm. Mm-hmm. And do we want to tell them the real reason you brought us all together, Scott?
No, go ahead, Leanna. You can tell them what the real reason is.
So Scott buried the lead a little bit here, but so we are all actually AYA cancer survivors, all four of us that are on this panel. So it's a pretty unique thing, I think, to be connected with just other young cancer survivors in the first place, let alone other young cancer survivors that are also PTs, is pretty remarkable. So like Scott said, we had never met in person, but we've been following each other on Instagram. I'd been following our other speakers on Instagram and just, chatting online. And so to meet them in person, well, I've only met Scott in person at this point, but to get connected with these people that have shared a lot of similar experiences was very cool.
Yeah, I'll just say at the end, I totally agree with Leanna, because I was diagnosed in 2005, so there was nothing. There was absolutely no AYA group, no anything. And then to actually meet physical therapists who are also survivors, that was a big deal for me. It got me really excited. And I was like, yeah, just show me where to be and I'll be there,
Yeah, and so that's what we're hoping to give our audience and to give those who come to our session is that yes, we're going to put on our PT hats, and give the didactic portion of that, but then the second half of our session is going to be a much more intimate Q&A, a panel discussion amongst the four of us. So we're going to kind of switch gears and put our survivor hats back on, because we're PTs, we have MSPT or GPT at the end of our names, but one of the things that you can't change as part of the fabric of our identity is being a cancer survivor.
Mm-hmm. Scott, you cued this very nice segue into the next question for me, which is, if you've ever been to CSM before, you know that most of the education sessions are 2 hours long, and they tend to be very lecture style, right? There's a topic and you lecture for approximately an hour and maybe 45 minutes, and then there's like a 10 to 15 minute question and answer session at the end. But it sounds like you're kind of changing that up a little bit. Why more of this emphasis on the question and answer conversation at the end of the session when putting on your patient hat versus, like coming to this purely from a physical therapist professional lens?
Mm-hmm. Because I think it's important that the patient voice is heard at these conferences. I don't think that we do a good enough job within our profession of elevating the patient voice. And so if this can be, kind of a spark, so to speak, I think that would be really important. But I also think it also humanizes us, beyond being PTs. Like we all, right, yes, we all show up at combined sections and we're all excited to see each other and we're excited to go to the sessions and we're excited to go, to all the things that are going on, and it's being a PT that brings us together. But we all have lives outside of that. We're all going to go back home to Texas, and we're going to go back home to Michigan and to Indiana, so or into Hawaii, right? And so, what do our lives look like, when we're not at CSM for 3-4 days? And again, I think that's what our hope is. And Eric and Leanna, I want to chime in because I want to know what you both think. But I think that this is again, it's an opportunity to do something dynamic, to do something different, and maybe to think about in the future, how can we as PTs, how can we elevate that patient voice?
Actually, Leanne, did you want to chime in, or?
You can go first. Yeah.
Okay, sure. I think the patient voice is something that is definitely something that needs to be promoted, especially with at APTA CSM, because I've been in the nonprofit sector for probably about 17 or 18 years, and just the personal stories of patients or survivors, even that carries so much weight, I think, versus just lecturing about young adult survivorship. Honestly, to me as a student way back when, that would just go in one ear and out the other. But to actually have someone there that has experienced everything, that definitely sticks a lot more.
Mm-hmm.
Yeah, I would piggyback off of exactly what Eric said. I think it's lecturing has its place, and that type of education and learning has its place. But I really think that in the healthcare fields and PT specifically, that having one active learning strategy, so using discussion, using Q&A, is much more impactful for participants. And then also just like they've both mentioned, like that patient perspective, that real life storytelling, personal experience, I think one makes it stick a lot more, and two makes it more meaningful. So if I sit in the classroom and I tell you a story about John Smith who had this diagnosis and yada yada, maybe a student will get something out of that, maybe they won't. But if I sit there and I share my story with my students and I relate it back to the clinical concepts that we're learning, you can believe that they're going to take a lot more from that. So I think that's part of what we're hoping to do.
And Leanna, as a as a professor, like I'm sure you can appreciate that. You're right. Like, if you bring patients into your classes, right? If you bring them into your labs, that's what your students are going to remember more, right? Rather than some made up case, right? Even if we're using cases from our own clinical practice, right? But if you bring a real person in who shares, their stories of struggle and, how they've had to go through. And again, this doesn't just apply to us as onco-PTs. Like it could be, in the neuro population, it could be in the peds population, it could be in the ortho population, it could be in any population that we as PTs treat. So yeah, I just think that it's just going to make it that much more real for everybody.
Mm-hmm. So speaking of real, it's already, potentially, depending on how you feel, it can be very vulnerable going up and presenting on a stage at a conference as big as CSM. But there's an added layer for y'all of not only are you obviously the professionals who are treating these patients, but you've also gone through this yourself. Was there any hesitation or any, just concern about, like, not only am I going up and presenting on a very large stage, is really important information, but also like I'm sharing of myself and my personal story that we don't necessarily always put out into the world like that? How, was that something that y'all thought of, or, you've come across as you've prepared for this session?
I can start that. When Scott proposed this idea, I did not hesitate. I jumped right on it and said, I think this is an awesome idea. Partly because at CSM last year, I had actually gone to a panel discussion of PTs that had all dealt with some sort of life-changing diagnosis at some point or another that impacted their transition away from clinical work and into something else. And I found that really interesting. And I found it very, very real and very inspiring that they were willing to share what those pathways looked like for them. As someone that made a transition from more clinical to more academic work, I found that really impactful. So I did not hesitate until, I don't know, sometime later, we were all chatting about, what questions we might ask. And Scott said, is there anything that's off limits? And then I was like, wait a minute. I didn't think about that. Maybe there are some things I don't want to share. But, when it comes down to it, I personally have sort of chronicled my experience on social media and have found a lot of community in that, and have found myself able to give back to the breast cancer community through my knowledge as a PT. And that's been really empowering and healing for me. And I think this is just another way to do that. So you're right, it's very vulnerable, but it's nothing that I haven't shared publicly before.
Nice.
Yeah, can I just piggyback on that? Like, I think I've met a lot of young survivors online through social media, like you have, and unfortunately, many of them have passed away. And that was pretty hard for me. So, like, I've kind of taken a back seat to the social media stuff, but yeah, I'm slowly starting to get back into it. So, yeah, I'm very glad that we're bringing this up because this population definitely is neglected. So I'm very glad to be a part of this presentation at CSM.
Yeah, and I think that we're in an age now where if you feel comfortable disclosing it, then you do put it out on different platforms. Obviously there are individuals who feel more private about that, and we totally appreciate that. And trust me, I was in that situation myself, in the early years of my diagnosis. I think, for us, we're not newly diagnosed. So we've had a little bit of time to kind of reflect on our journeys, into survivorship, and what does that mean? What does that look like? And, what are the ups and downs that we've, had to traverse through all of that?
Mm-hmm.
But I also do think, again, that it's whenever we do share our stories on whatever it might be, if it's on Instagram or, if it's going to a classroom, I go back to my alma mater, Ithaca College, every year to tell them my story. Again, to make it real, to say that I sat in that seat, right? I went to all the same bars that you all did, right? And they still have some of the old professors that I still had, that I had back then, right? And so I think it can also be a teaching tool as much as anything else, to say that, yeah, I'm one of you, and I still got cancer. So it becomes a teaching tool as much as anything else.
So we've talked about a lot of reasons already, but why do you think, as a speaker of this session, why do you think it's so important for attendees to go to your session?
I think it's important that for the participants who show up, or who if they listen to it on the on demand, which again, our course will be on demand. We are going to be recording it live. As the discussion amongst the four of us, we agreed that being able to record it live was going to be more authentic than for us to try to pre-record it. But regardless, it will be recorded and it will be on demand. So whenever you access it, but of course, we'd love to see you live. That the needs of the adolescent and young adults are multifactorial, and to understand what those concerns are, to understand the different transitions that the young adults face and how those are interrupted by the cancer diagnosis, and being able to then talk about, for us as PTs, what we can do. We don't necessarily need to have all the answers as PTs. Not to give anything away, but I tell my students that by and large, most of your PT interventions for an AYA are going to be similar to somebody else. If you're treating a 30-year-old with breast cancer, the manual techniques, the stretching, the range of motion is going to be very similar to what you're doing to somebody who's 60 years old who has breast cancer. But there are the other layers. There are the other things that you need to be cognizant of, like fertility preservation, body image, financial toxicity, that are all much more a concern to the AYA at the age of 30 than at the age of 60 or 70. So if we can heighten that awareness and have our PTs be able to ask those questions when they go back to the clinic on Monday, that they will be more cognizant to be able to ask those questions and be more aware of that, I think that's a win.
Yeah, I think I echo all of that. And I think the thing that I really hope that attendees are looking forward to, and that they eventually get out of it if they attend or watch the on demand, is that exactly what Scott said. It's not that the treatments are going to be any different, but it's the lens with which you approach it, and getting people to understand what that lens might look like and how that lens has to shift from patient to patient. A personal piece here is that I started treating patients with breast cancer before I was diagnosed. And I had a couple AYA breast cancer patients, and pre-cancer me, said some things that I look back and was like, I would have smacked someone if they said that to me. And, I'll never forget that, because I often think, okay, how did that patient feel when I said whatever blissfully ignorant thing I said? Because I wouldn't have felt good about that. So I think I'm hoping to impart, again, that lens of how you approach these patients and how you are curious and sensitive and open and helpful with their needs.
Eric, anything you want to add on why you think it's so important for people to attend this session?
I think Scott pretty much nailed it. So I mean, I think that anything I say is just going to be echoing what he said. So the main thing is that I think a lot of participants at CSM are going to be able to relate to all of us. So I think that'll make it a whole lot more powerful.
I'm really excited too. One of the things that I know, because I've known Scott and Eric previously, and I've obviously met Leanne for the first time tonight, is everybody was kind of in different stages of your PT career when you got the diagnosis. And I'm really excited to hear that. And I don't know if that's necessarily something that is going to be like explicitly addressed in your conversation, but I do think that is going to be interesting to pull out from listening to this really important talk. So that's something I'm excited about, that I was just thinking of, like, everybody has a little different kind of timeline here, and I think that's really, really interesting. So as we kind of close out today, what is one thing, or maybe a couple things, that you want attendees to take away from your session? Like, they walk out and they say, that was the best session that I've ever been to at CSM. I'm going to go back to my clinic or my hospital on Monday and I'm going to implement these things, or I'm going to feel better about XYZ. What are those 1 to 2 things that you want people to take away and be like, oh, this was it?
Leanna, you want to start with that one?
Sure. I think for me, it would be an open mindset or a growth mindset around working with AYAs and not feeling stumped when an AYA walks into the doors of your clinic.
Yeah. Oh, I like that a lot.
Yeah, for me, it's just that, cancer can happen to anyone. I mean, don't just brush it off. You gotta make sure that you screen for it, and like, what the warning signs, red flags are. So, I think that's very important.
Mm-hmm. Mm-hmm.
Yeah, I would say a couple of big things would be, first and foremost, don't make assumptions. Just because this person walks in the door and they're 28 years old, say, oh, you're 28 years old, you'll bounce back just fine. I'm sure we've all heard that ourselves. And so you can't make assumptions, right? And again, we don't need to have all of the answers, but to know what those resources are, to kind of keep them, okay, I'm really going to date myself here, but to keep them in your Rolodex of resources. You're laughing. I see you, Elise. You're laughing at me over there.
I mean, I know what it is. Like,
oh, good. At least you know what it is.
These days, it's just called an iPhone.
Yeah. Anyway. Keep it in your iPhone. Keep it in your Rolodex. Whatever. Keep it on the sticky note. I don't care. But, to have resources like triage cancer, like, to be able to help with the finances, to have the resources like First Descent, to have great podcasts to listen to, like I'm Too Young for This Shit, right? Like, who has been on this show before, right?
Love them, yes.
Right, exactly, love them. And again, they are so authentic, they are so real, in telling their stories. And so to know what's out there, and to be able to connect our AYAs, because our AYAs, they're not going to go to a support group and sit in a room with people who are 30 years older than them, because they're in a different life stage. They cannot relate going to a support group where people are their parents' age. Their needs are different. And so that's why we need to, again, Leanna, to your point, keep an open mind, allow for growth. These patients might actually be your age if you're a young clinician, right? Mm-hmm. So how can you make those connections? And then what are those resources that you can connect our AYAs with?
I would actually add one more thought, if I may.
Yes.
I think another thing that I'm really hoping that attendees get out of this is to not be afraid of working with people with cancer in general and of working with AYAs. I think historically, we do a really good job of saying that cancer is a contraindication to everything. I feel like that's kind of the running joke in PT school. And that's just simply not really true anymore if you look at all the evidence and if you consider best practice and clinical reasoning. So like Scott said, we're not going to have all the answers and we can't possibly have all the answers, but if we can get people to not be afraid of putting their hands on these patients, of talking to these patients, of working with these patients, exercising these patients, and we can at least get you to have an open mindset about it, you're going to change some lives.
I'm going to add on to that one more bit, Leanna. So I know Scott has heard this because I've told him previously, but something I haven't really shared a whole lot about on the podcast is there was a time period in my career, like a couple years ago, where I was treating a lot of AYA patients. And I was very much like, oh my God. First of all, kind of speaking to Eric's point previously of these young people have cancer, like my age and younger, which was frightening. But then also like, what do I do with them? And was kind of operating under the what Scott mentioned of like, they're young, they'll bounce back. And, unfortunately they didn't, because that's just not how the body works sometimes. But I had one really, really cool patient. She was mid 20s at the time and everything. And I worked with her for a few months. And, eventually, like, I left the facility and I lost touch with her. Fast forward, she found me. She is now a practicing clinician. She is now a CLT, and she is getting into oncology rehab. And so, to build off of Leanna's point, like, there's a real opportunity here to make a really, really special difference with this patient population. And you never know, they might go from your patient to a fellow colleague pretty soon, which is pretty dang cool. And I think that just speaks to kind of this AYA experience of like, their whole life is potentially like at their fingertips. Ideally we're getting them into this long survivorship phase. Like this young person that I worked with now has so much more of her life to live. And I think that is something that sometimes when we're working with our older patients, we don't always think of like, my 65-year-old patient, we're retiring, we're entering our golden years, we've probably got a couple decades or so left. I mean, this young person hopefully has another 60 to 70 years of life. And how do we kind of plan for that and think about that and just zooming out to get a much more big picture of kind of what the patient is experiencing, all of this with an open mind. And so last little kind of logistics questions. We already talked about your session is going to be recorded live at the conference, which is pretty dang cool, and then available for on demand later. When is the session so I can block it off on my calendar, y'all?
Well, it just so happens that it's so conveniently right after your session, Elise. It's funny, Elise, the times that, that I've worked with you and you've had me on for like the cancer rehab community and, I hit lead off, but at CSM, you're hitting lead off. You were the very first one at 8 a.m. on Thursday, right? So you are the leadoff hitter now, which is exciting. So we follow you in the lineup. We are Thursday, the 15th at 11. So the lunchtime hour. So bring your lunch and come hang out with us. Don't have a room yet. I'm sure they'll give us a room at some point. But yeah, go. So shameless plug for you. Go to Elise's talk from 8 to 10, and then you got time to run to the bathroom, grab a coffee, and then come hang out with us at 11.
And meet some really cool people like who we have on the interview this evening in the hour beforehand, and then just jump right into your session. Love that. Okay. Last question, I pinky promise. Where can people find you and connect with you? If you're comfortable sharing your socials, please do so now. If not, just say, no thanks, Elise. I appreciate the offer.
You can find me on Instagram. My handle is Affirmations from Cancer. That is my sort of personal, where I share a lot about my cancer story and then also a lot of PT relevant things. So that's best place to find me.
Yep, and I'm on Facebook, Instagram, and X, I guess. It's Eric Anthony Galvez. So yeah.
Perfect.
I'm gonna do a shout out for Bree, who's our co-presenter as well. Is she? I think she's just Bree DeWitt on Instagram. Is that right?
It's something along those lines. I will of course, find it for sure and then link to it in the show notes also.
Okay.
Because obviously we definitely want, again, I know Scott mentioned it briefly, but Bree DeWitt is also presenting on this amazing panel. She has also been on the podcast. She is amazing. So we'll definitely link to her. Because yeah, she's another really good one to follow on the gram
Yeah.
for sure.
I think she's
She is,
Bree. Oh, go ahead,
Mhm.
Leanna. You got it.
yeah, she's Bree.d.pt.
Perfect.
Oh, and
Scott.
I'm real original. I'm just at Scott Capozza at Instagram, Facebook, and then whatever Twitter X is called these days.
Perfect. Love that. And like I said, I will link to all that in the show notes so y'all will be able to click on that and be able to follow each of these amazing speakers, especially in preparation for their really, really exciting CSM session that I have been looking forward to for a really long time. Scott did actually tell me about it like right after San Diego. So I knew it was coming down the pipeline, but it's really exciting that now it's like official. We are counting down the days. We're 2 months at the time of this recording away from it. So it's almost here, y'all. I'm so excited.
It is very exciting, and it's just going to be so exciting to see everybody again in person. Like, we all got our dopamine hit by seeing each other in San Diego, and so we'll be able to get a little more of that when we see each other in 2 months in Boston.
Yay. Well, Scott, Eric, Leanna, thank you so, so much for coming on the podcast and talking about your CSM session. Very important, very necessary, very long overdue to have this kind of a conversation at CSM. And I'm really, really glad that y'all are leading the charge on this. So thank you so much for spending your evening with me. And thanks for coming and talking to my listeners about this. I'm really, really excited for this session. And I know that they are too.
Thanks for having us.
Exactly. Thanks for having us.
At least you're the best. Thank you for all you do.